Good afternoon. I'm Monica Hendrickson, the Public Health Administrator for the Peoria City County Health Department, and welcome to our COVID-19 update for the Tri-County region of Peoria, Tazewell, and Woodford counties. For today, Thursday, August 26th, the Tri-County now sits at 48,556 cases to date. That includes the 24,726 cases in Peoria County, which is an increase of 305 over the past week. 18,566 cases for Tazewell County, which is an increase of 361 from the last week, and 5,264 cases for Woodford County, which is an increase of 88 cases over the past week. Our total number of deaths now is at 785, which is an increase of 8 over the past week. That includes 2 for Peoria County, bringing it to 381, 5 for Tazewell County, bringing it to 306, and 1 for Woodford County at 98. Tazewell, of those 5, Tazewell is reporting 4 of those deaths today. They include a female in her 70s, 3 males, 1 in their 60s, 1 in their 70s, and another in their 90s. Regarding our hospital data, we currently have 25 ICU beds in use and 65 non-ICU beds in use amongst the 4 hospitals: OSF St. Francis Medical Center, UniPoint Health, Methodist, Proctor, and Pekin. As I mentioned earlier, Peoria County is now over 300 new cases in 1 week. The last time we saw this number was in May 12th. That same day, we also averaged 45 new cases each day, which is what our current average is for Peoria County. The Tri-County is averaging 100 new cases a day, which was similar to May 9th. And the last time we had 65 non-ICU beds in use due to COVID was also on May 11th. Again, all of this goes back to our early May statistics regarding cases and hospitalizations. And let us not forget that we were actually coming down from a surge in May. When our community saw a peak of 260 cases in the spring, and we had that peak of 376 cases in November daily. This is not the path we should be on at all. Even with this highly contagious Delta variant, we have vaccines that are effective. But we only have 48.7% of Peoria County residents fully vaccinated, 49% of Tazewell County residents, and 46% of Woodford County residents. Vaccinations continue to prove to be effective in reducing the risk of severe disease and death. They work in protecting our entire community, and we need them to combat this virus. Today, the governor announced vaccination mandates as well as masking requirements for indoor spaces. Our speakers today will talk through all of that with you in further detail. But to give you an assessment of where we sit today, I'll bring up our first speaker, our infectious disease specialist from UniPoint Health, Dr. Sudhindra, to talk about what we're seeing in our hospitals.
Good afternoon. I'm Praveen Sudhindra. I'm an infectious disease and critical care physician with UniPoint. And I've been treating patients with COVID-19 over the past 18 months over the course of the pandemic. As Monica said earlier, over the past month, we've seen a steady rise in the number of cases in the hospital. We have over 20 patients right now within the UniPoint system. About a third of them are on ventilators, and the overwhelming majority of them are unvaccinated. Over the course of the last several weeks, I have only taken care of 2 vaccinated patients in the ICU. 99% of the rest are unvaccinated patients with severe disease. And this, at this point in the pandemic, is essentially preventable. It leads to immense strain to our healthcare system. our healthcare workers, nursing staff, physicians, advanced practice providers. It also strains the supply chain in terms of medications that we're currently using to treat these patients with severe COVID-19 disease. And in some instances, we're also seeing shortages of some of the medications that we need to use. At this point, our message remains firm as it has over the last several months. The vaccines are overwhelmingly safe and effective, as evidenced by the majority of healthcare providers who've been vaccinated. Even in the face of the more infectious Delta variant, there is still good protection against severe disease, and we have data to back that up as well. So our message remains strong and clear. Please get vaccinated. As far as booster doses are concerned, currently we are offering booster doses to patients with certain qualifying medical conditions that compromise their immune system. We are still waiting for further guidance to offer booster doses to the rest of the population that have already received 2 doses of the mRNA vaccination or the Johnson & Johnson vaccine. With this, I'd like to open it to questions.
Are you seeing more children in the hospital with COVID cases or RSV? I know there's been a big uptake in other respiratory illnesses as well.
So to me, this will be secondhand information because I'm not a pediatrician, but yes, I have seen more RSV cases come up. There have been a few more pediatric cases with COVID than there were on previous waves that we have seen. And I know this because my wife's a pediatrician with the Children's Hospital, and she's been seeing more patients too.
You're talking about the booster doses. Are we expected to be getting any booster doses?
Yeah, so based on information we are seeing from the government, the HHS and CDC, the expectation is at some point over the next month or so that booster doses are going to be given to everybody who's been vaccinated with 2 doses of the mRNA vaccine. When exactly that will happen and in what manner it will be rolled out, we still don't know.
You mentioned most of a good portion of healthcare workers getting the vaccine and how effective it is. But we've seen, as you know, across the country, there are nurses and medical professionals that are just not taking it. Why would they say no to something that you say is so effective?
The short answer is I don't know, but I suspect it has to do a little bit with fear of something that's relatively new. The perception is that the vaccines are new and untested, and we need to wait for more data. To that, my response is that 8-9 months after we've had vaccines roll out and we've had millions of people across the country get vaccinated, I think we have enough information at least to tell us that the vaccines are overwhelmingly safe. Yes, there are some side effects, but these have been well documented and studied at this point. In the majority of cases, vaccinations don't tend to give you side effects several months after the fact. The majority of side effects, if they do ever happen within a few weeks of administration. And I think at this point in the pandemic, we have a reasonable handle on what kind of adverse effects to expect from the vaccines. And healthcare workers are at the highest risk, so their risk of acquiring COVID-19 and having a bad outcome from COVID-19 far outstrips anything.
You're seeing a lot of patients that talk to you and still have concerns and are still skeptical?
Yes. Yes, even some of those who are infected and in the ICU remain skeptical of vaccines and the disease process as a whole, which is unfortunate. We try our best to continue to educate them and their families to get vaccinated. But yes, it is an ongoing challenge. Thank you.
To kind of add to that data point regarding children being seen in terms of cases, to give you a little bit of perspective, for Peoria County specifically, the highest number of our active cases are amongst our 20 to 29-year-olds. They account for 21% of our cases, while our 10 to 19-year-olds account for the second highest number of active cases at 17%. And this makes sense because in terms of vaccinations, this corresponds to the least vaccinated group, excluding those that are actually ineligible because of age. Both of these age ranges have less than 40% of their population vaccinated. So again, what we're seeing in cases is completely different from what we saw this past this past year. To speak more about, we've heard the governor talk about mitigations. We've talked a lot about the impacts it has on business as well as the new requirements. We have Chris Setti, CEO of Greater Peoria Economic Development.
Thank you, Monica. It's almost unfortunate that I'm back, right? You know, that it's like the Al Pacino in Godfather 3. Every time I think I'm done with these things, they pull me back in. And so it's sad that I'm here, and I'm sure Monica is tired of giving these press conferences for the same reason, that that means that, you know, we are regressing as a community, and what those impacts are on our businesses, and the folks and ordinary people. So, you know, the governor has announced a mask mandate starting on Monday for indoors. And so, I think it'll be important for people to recognize that. And my plea, I've seen a lot of people on Facebook and other social media platforms and others saying, I'm just not going to do it. And because for whatever reason they feel it's a violation of their personal freedoms, my plea to individuals is to consider others. Whatever you might think of COVID and these mitigations, think of the shopkeepers, think of their employees, think of the waiters and the waitresses who are being put in the position of trying to enforce what they feel is right, and to respect the decisions and the requests of the business owners. We don't need to be adding additional stress to what is already a stressful situation for anyone. And quite frankly, I find it selfish at times when people are going to refuse and make a big deal over something that is relatively harmless to an individual, to wear a mask inside of a restaurant. I understand that there are people that disagree with it and maybe don't believe the science or believe public health officials. But the reality is making a huge stink over it, making a big deal, arguing with, likely a minimum wage worker, somebody who didn't sign up to be a police officer in addition to being a waiter or a grocery store clerk. It's just something that I would implore people to really understand, that when you're standing up for what you think is your individual right, you're making it hard for a lot of other people who are just trying to live their lives and do their jobs. That might be controversial. That might get me in trouble with a few folks, but it's something that I truly believe in, is to respect others and what their wishes are. The other thing I did want to mention, because if I've got a microphone lately, this is what I'd like to talk, that there are grant relief out there right now for businesses that were impacted if they had less revenues in 2020 than they did in 2019, there's the Back to Business grant that's being offered by the state of Illinois. Grants from between $5,000 and $150,000 based on the loss of revenue between those 2 years. Nearly every business is qualified. Every small business under the, as long as you were open in 2019 and have less than $20 million in annual revenue, which is an awfully big small business, $20 million, qualifies for the grant, but there are certain priorities. We've already seen almost 20,000 applications for this $250 million pot of money have already been filed, and it just opened a week ago on August 18th. It's open until October 11th, but I would urge people, businesses that qualify, not to wait. There are priorities that DCEO, the state of Illinois, is going to be looking at: hotels, bars and restaurants, gyms, dry cleaners, barbers and salons. Those are the types of businesses that were the most impacted, through COVID, and are the ones that should be applying right now, because you'll get the first look and especially the other priority area that is anyone who hasn't been assisted in another way. If you didn't get a PPP, a Paycheck Protection Loan, if you did not get a restaurant revitalization grant or a downstate business stabilization or a business interruption grant, and my apologies for speaking fast with lots of just acronyms, those businesses are also prioritized. And so those are the ones. You can go to our website to get more information, which is www.gpcovid.com. There's also a place where you can request assistance, and we have a group of community navigators. We have 10 different nonprofit organizations who are trained to help and provide one-on-one assistance to businesses. So that's www.gpcovid.com. Happy to answer any questions.
Are you dealing with a lot of businesses, or I imagine you will be, that are hearing, for example, about the new indoor mask mandate, and they're saying, oh, no, not again. I imagine there are businesses that frankly just don't want to deal with this anymore and don't want to force the rules on their customers.
I haven't heard from any businesses today. I mean, this was just announced. I think it was hinted at yesterday and kind of announced today. I haven't heard from any businesses in particular. I imagine that would be a good question for a chamber of commerce, who may be more in touch with their small businesses than I would be. I do imagine that it's another layer of stress for a business owner to make the decisions that they are being asked to make. I will say that we are starting to see. I've seen this nationally. I haven't necessarily seen it local. Less people dining indoors again, more takeout. So I do think that this wave of infection that we're now seeing is having an impact on our business community. Maybe not in the way, obviously, that mitigation impacts like shutdowns and limitations had, but still, I think it will affect consumer behavior.
And I'm not sure if this is a question for you or for Monica, but will there be any local enforcement or repercussions for businesses who may choose not to abide by the mask?
That's a question for Monica, not for me. Maybe if anybody else has questions for me, and then Monica can cycle back up here as she introduces the next guest.
How busy have you been with the grant process?
Very busy. It's been great. We have really great partners in our community navigators, and they've all been out advertising, email blasts, going one-to-one. I had one of my employees go down and work with 4 different businesses in Mount Pulaski, which is a rural community in Logan, to sit next to them, to help them fill out the application. So yeah, it's been, 20,000, I can't tell you yet how many are from our region, but 20,000 applications in the first 8 days is a pretty good sign that there's a lot of interest in it out there. All right, back to Monica.
To your question regarding the enforcement of the mask mandate, we also are waiting for further guidance from the state on this. Public health, we are juggling a lot. We are juggling contact tracing, investigations, outbreak controls, vaccination campaigns. I think IDPH recognizes that there is a lot on your local health departments just for controlling the virus alone, not to also then add on the policy questions that come with masking mandates. And so first and foremost, public health are educators. And so the first thing we're going to ask is that people comply, do the right thing, help us slow down this variant. To give perspective, what we were battling last fall was alpha and beta variants, which in all honesty were not as transmissible as the Delta. So when one person was ill with an alpha, they were routinely getting maybe 2 to 3 people ill. With Delta, you're looking at numbers at 7 and 8. There's a higher level of transmission. And so, masks are effective. There is so much data out there. And I mean real data, the actual peer-reviewed scientific research that is validated, that data that's out there that shows you the effectiveness of masks. And the vaccine itself, again, is a great pharmaceutical intervention, one that I wish we had last year. At this time, we would be maybe in a different place, but we have it now, and we just want more and more people to take advantage of it. The next speaker is our superintendent for Peoria County Regional Office of Education, Beth Kreider. Because today's announcement, I think a lot of you may have already started seeking out comments from her, so to kind of give that platform as well as to talk about the implications. Before she comes up, I will just give one data point. January 25th is when teachers were first eligible for COVID vaccines. We did some initial surveying of schools about a month and a half out to see whether or not we had to do as county vaccination leads to go back out to the schools and do some vaccination campaigns. When we did survey them I believe it was mid-February, 78% of our schools came back, or educators came back and said they had either their first or had completed their series of vaccines. So we know in February we had a large percentage of our teachers already vaccinated. So to talk more about this, Beth.
Hello, thank you again, Monica, for being such a tremendous partner to the public schools and the private schools here in Peoria County. Hi, my name is Beth Kreider, Regional Superintendent for Peoria County, and your public school system and private school system last year learned a lot. Learned things that we didn't think we would have to learn, and specifically when it comes to learning, we did our best in about 48 hours to convert the entire educational system to remote learning. And we implemented all kinds of new things, new practices, new policies, and we did the very best job that we could. But as we have learned from attendance data, from academic and learning data, it is best to get your kids in school. Face-to-face instruction is critically important. It's not just important for learning, it's important for mental health of our children. There are so many critical milestones that happen within the public school system. Friday night lights, basketball games, all those things that come with being in school. And those things are just as important as the academic learning. And so we need face-to-face instruction. And for that to happen, we need every possible layer of mitigation to keep our students safe. So with today's announcement about vaccinating teachers and all educators, and as I heard, those that work in the school system, it's just a way for us to ensure we can stay in face-to-face instruction as long as possible. We're doing many other layered mitigations as well with masking, social distancing, washing hands. We're still doing all of those things. So there was also an announcement today from the two major teachers unions, Illinois Federation of Teachers, Illinois Education Association, both coming out in support of this, saying it's just another way to help keep our students and our teachers safe as they work together in the classroom, while providing an option for the teachers that can't or won't get the vaccine by being tested weekly so that we can ensure that our classrooms are safe. And so with that, I think it's best if I just take your questions.
Yes, one question I have is how much of this is going to get caught up in collective bargaining?
So I did talk with one of our local teachers unions today. There could be some collective bargaining issues around it, but in any contract bargaining agreement, you can't break the law. So if this is a mandate, there will be the option of the weekly testing. But quite honestly, the devil is in the details. And talking with some of our local superintendents today, we have not worked out what does that look like to get tested weekly. How do you report that back to your administration? We still have to work out some of those things. Your local school districts are working on implementing testing within their own buildings. But to do that, you have to have a school nurse. And not all of our schools in Peoria County have a school nurse. So if you have to go off-site to get testing weekly, what will that look like? We have to work out all of those things as we all found out, like everyone else did today, what the mandate was going to be.
I know Monica said that a majority of teachers and educators are vaccinated, but when this announcement came out, was there, comments, backlash saying, no, we're not doing this, or is it still kind of up in the air? How people are feeling?
I've not heard. I've not been on social media much today, so I am not sure what the feedback on that is. I'm sure local teachers unions will hear about that if there are some concerns. Administrators will start to hear that. We have a weekly standing call as superintendents where we join together, get questions clarified, and so we'll see where that stands as of next Monday.
Parents largely, I think, are still saying that kids can't handle wearing masks, but I've also heard it said that, kids maybe adjust to these things better than maybe adults do. Which do you think is kind of the real deal? Do kids handle this well?
My entire teaching career was at the Blesky Hinton Early Childhood Center, and my very close friends are all there. So that's early childhood, 3- and 4-year-olds, 5-year-olds, and they're all wearing masks every day and have been since July. I think a lot is in the approach of how we as adults model that and how we encourage it within our students. Do I think that some students struggle? Of course, absolutely. And so if we all work together now to try to get through this, hopefully we can get to the place where the masking will be optional, and we need the vaccine for 12 and under as well. Great, thank you.
So a quick follow-up to the question regarding masks. It should have been shared with all of you. There will also be, I know, a press release that follows too, but the health department, Heartland Health Services, OSF Healthcare, UniPoint Health, and the University of Illinois College of Medicine work together to really provide healthcare providers for children guidance around masking and what it means. And I think what's really key is that, again, using evidence-based and data, they really follow the same key points, that children 2 and under have difficulty. They've been able to wear masks, but there might be challenges with that, that there are certain conditions that we sometimes go to and say that's the reason why a kid can't wear a mask, such as asthma. But in fact, that makes up the higher risk for COVID complications, and that's why they should be masking. They even talk about, in the children that may have sensory issues and how do you introduce masks. And so, again, I reiterate this point, but it also talks to the point about, we've heard of you can go online and get your own exemption for things, and really working with the schools, this is a challenge because, again, it becomes back to the safety of the students and staff in an in-person learning environment. So when we talk about these exemptions, we're asking providers that it needs to be written by a physician, an MD or a DO, or an advanced practitioner, and they must include their NPI number along with a diagnostic code, as well as assessment of the condition, when they plan to reassess, and any specific accommodations. True exemptions, this will be easy for a provider to go through this process. Those that may be just looking to collect your $20 online, not necessarily. And so again, this is information because just like other scam artists out there, we are seeing scams around mask exemptions as well. So again, that will be shared with you through a press briefing, but more than happy to answer any questions about this or any other of our COVID comments.
Seems like at this point the consensus you see requirements for vaccinations for the military, for teachers, healthcare workers, it seems like the consensus seems to be moving towards the only way we're going to make this pandemic endemic is by mandating the vaccine. We've gone months now where they've been widely available, and it seems like the people who run them got them, people who don't haven't, and the only way to move forward is to mandate it.
The question, or commentary is about, getting to this point of mandating vaccines. So first and foremost, OSF St. Francis Healthcare System, UniPoint Health, and actually Peoria City County Health Department, we all have mandated vaccination policies. We've all adopted these, and we highly encourage and recommend employers to do the same. This is not about creating an issue about a belief system. This is about how do you protect your employees? How do you protect your clients? And how do you protect your public? And in good consciousness, when you have something that works as effective as a vaccine and you don't provide that out there, that speaks to how do you really care about your employees, right? If you're not going to give everything to protect them. But to your point, it is sad that we have to get to a variation of mandated requirements. The reason from those individuals that were the ones that lined up, were busting down the doors to get their vaccine clinics. I have a grandparent-in-law that might have showed up to her appointment 4 hours too soon. You go to people that, are completely against vaccinations. They don't fully understand the science, and they also don't want to understand the science behind it. They don't care to. And then there's a gradient. And in that gradient, you have misinformation, not a full understanding. Some people that are just waiting for an age requirement. There is a very large spectrum in there. And I think what we saw is that as vaccinations opened, we saw different levels of that go through. I think the Pfizer announcement hopefully will trigger a large rush of people that said, hey, I'm just waiting for it to have that final FDA gold seal. And that might be the next grouping that we see. And then now mandates, as an employer, as an employee, what does that mean in terms of protecting each other? And so I think that's the next layer you're seeing come through. There's never one size fits all in a response. We all hope that everyone would have taken advantage when we could, but we are at this point, and if this takes us across that finish line that we are all hoping to be at, then it's one step closer.
Seemingly the Peoria or the Tri-County area has just been trending over the past few weeks. Did the governor's announcement really come as a surprise?
So in our trending of our current data here in Peoria County, actually in Region 2, was the governor's announcement a surprise? No. I think we have counterparts in Southern Illinois that are looking for ICU beds, that are looking for any assistance as much as possible there, even for contact tracing purposes, are our area that kind of borders Iowa and Missouri, same idea. They're having a lot of difficulty here. Our numbers, we're still above that threshold in terms of our hospital capacity, but it's something that we're continuously monitoring. To be back to our numbers when we were decreasing from our surge in spring makes me nervous, because it can easily flip and keep on increasing and have another surge. And so none of this is a surprise to us. I think what maybe is a surprise is that that not all entities were included in this first round. We may expect to see other congregate living settings or congregate settings be also listed on as requiring vaccinations in the future. So I think, it makes sense why teachers and education was focused right now, because they're all coming back, but I wouldn't be surprised if we see others get added on. Because again, right now, this is pre-K to 12. This does not address daycares.
Is there a timeline for waiting on that further guidance from the state on enforcing masks on Monday?
I think the announcement was made today. I think we're all waiting for the executive orders and everything to be released. Yeah.
How big a concern is the Lambda variant? I know we've heard some buzz about it.
So I'm going to actually let our infectious disease specialist talk about it. But, I think any variant we're always concerned about. And I'll just give you another stat that we know of the sequencing of the cases of COVID we have right now. 99% of them are Delta. So, but still, much bigger difference.
So there isn't as much information right now available about the Lambda variant, but you hear snippets about it being more infectious, potentially able to evade the vaccines a little more efficiently. We don't know. What we do know is, as long as there's circulation and infection at high levels in the community, you are going to keep seeing the virus mutating. And the biggest selection pressure to the virus is vaccines and immunity that's developed in the population. So it shouldn't be surprising if we have a large proportion of the population unvaccinated, that you're going to have variants that could prove to be more infectious and able to evade existing vaccines down the road, which is why it becomes even more important that we quickly vaccinate the vast majority of the eligible population.
So that's the only way to prevent the virus from evolving or mutating as it jumps from host to host, basically.
Right, because if you have 100 million people who aren't vaccinated, you have enough transmission happening that it could eventually mutate to a point where it evades, the vaccines that have already been administered. So that puts you in an even more precarious situation than before. Hence the urgency behind getting everybody vaccinated. Thank you.
I don't know if you guys possibly know anything yet. The Civic Center testing site, will it be coming back? It was supposed to be, but what kind of happened?
So the Civic Center testing site, I think it goes back to, from our conversations with the state, we were notified by our regional health officers that a site was opening up. I think there may have been logistics or operational checkpoints during the state's process of approving a site that needed to go back. We've been in communication with them. We do know that there might be some testing coming, actually in conjunction with concerts, to assist with getting people vaccinated and tested before any type of large-scale events. But Peoria Civic Center has always been a fantastic partner with the health department and the state, so I know that option is still available. I think it's now just more logistics and planning to see what happens. But it's not officially, completely shut down, never happening. We just don't know what it's going to look like in the future.
I was going to say, did that conversation start because there's more demand for testing now? Because I know testing's widely available, and those sites were seeing such decreased usage, the state said we're going to shut it down.
So the request to actually get the community-based test site back in operation in Peoria was happening for about a little bit over a month or so, and largely it happened because of the need for additional testing, as well as the fact that our healthcare capacity that could assist with that was now going back to response mode. The individuals are able to provide testing. If that's the only thing that they're doing is providing just surveillance testing or basic, symptomology testing, and cases are very low and transmission is very low, that's something that our healthcare and hospital and our FQHCs can all handle. But now we're at a point where we have a growth of cases that require not only testing for them, but all their close contacts, and it's even putting pressures on our testing and capacities within our system. So having that test site was really to be an option available, especially in our region. The closest one we have is Bloomington. So we were really, the Civic Center site was serving a lot of Western Illinois. Okay. With no other questions, again, just want to reiterate, please get vaccinated. That's going to be the common conversation that we have. As always, we will continue to have these briefings as things update or change, and so you'll always have that communication through our PIO network. So thank you very much.